This technical report was published last year, developed by CEN, the European Standardization Organization, and translated into a British technical report, a published document. I'm going to say a bit about how we developed this document. I was a member of the CEN committee that developed the document over quite a few years. I'll tell you a bit about what it actually says and then what it means in terms of lighting design and for other applications. But what we look at primarily is how can we maximize the benefit from exposure to light. We know some things about this. The most important one is that if you have no light at night, you tend to sleep better. But that shape changes depending on the tasks we're doing, depending on our age, and lots of things. And this was really the starting point for this. But our involvement as an organization, as Public Health England and our predecessor organizations, was really looking at specific groups of people who were affected by light that was unusual. So their circadian rhythm was going to be different to the general population, and they were exposed in environments where the lighting was different to normal. So the left-hand group is shift working nurses. This is a critical care hospital where the medical team work under artificial lighting all of the time. And they work a 13-hour shift, 12-hour shift and 1-hour handover. And that got us interested because there's a fair amount of evidence that there's a link between shift work and cancer. And we wanted to know why that was. And really the hypothesis is that if you disrupt the circadian rhythm, disrupt the production of melatonin, then you disrupt the body's repair mechanism. So if you get exposed to light at the wrong time, then that can cause cancers to develop that might otherwise have been repaired by your body while you're asleep. As a tangent to that, we were quite interested in what happens to patients. Patients are in those environments for generally a much shorter duration in terms of days, months, etc. But they are in there the whole time, whereas the shift working medical staff go home and do different things. So one thing we were looking at was how can we actually monitor what they get over a 24-hour day. The other group is pilots. Pilots have a higher risk of skin cancer. Now, everyone assumes that's because they go to sunny climates and go and sunbathe, but in fact they don't. And they have a really unusual exposure to light. Certainly on a transatlantic flight or a flight to Asia, their exposure to light is nothing like what it would be if they were on the ground. And we're very interested in that. So this committee, CEN TC 169 Working Group 13, title of which was Non-Visual Effects of Light on Human Beings, was trying to work out a way that we could do something to give advice to designers, to employers about the best ways of having light exposure. And what has really triggered that was that the discovery of these intrinsically photosensitive retinal ganglion cells in the retina, the cells that don't actually contribute to vision, but contribute to other aspects. The problem was most of this research has been done on cells in petri dishes or on mice. Now, most of us probably don't consider that we fit into either of those categories very well. So this was the first challenge. That committee at the start took an action spectrum for melatonin suppression. And you might think, well, that's actually very important. It is important if you are looking at your daytime into nighttime exposure and comparing the two. You clearly don't want to do anything that's going to suppress your melatonin production as you go to sleep. Melatonin is essentially a hormone of sleep, and as I said earlier, it does all this mopping up of any harm that might be in your body. For that action spectrum, if you look at where it peaks in that plot, you'll see it's around about 450, 460 nanometers. That data came from cell data in the absence of the eye. And that was quite important. And really the discussion at the time was, well, let's just publish that action spectrum and tell people you need to maximize exposure at those wavelengths during the day and not have any exposure at night. Very simple model until you start looking at the data and questioning how well do we understand that spectrum and what are the implications as we actually go through a 24-hour cycle. And several of us on the committee felt that the science wasn't mature enough, and we convinced the German lighting industry to sponsor a workshop and then told them they couldn't come to it because we didn't want the industry influencing what was going to happen in this scientific study. So this very small group of people actually consisted of all the world leading experts to do with the interaction of light with the eye, not vision, so non-visual aspects. And the guy on the bottom right, Rob Lucas, chaired this along with the guy next to him, Bob Brainard. Now, Bob Brainard and the guy on the left, Chuck Seisler, have been very heavily involved in the lighting environment on the International Space Station. How can you give the astronauts who are on the space station, when they have a very short day, a 24-hour day? And really the outcome from this is freely available in Trends in Neuroscience. You can download this paper, but the key element was, although people have been looking at the intrinsically photosensitive retinal ganglion cells and considering they were the most important bit, it turned out they are just one part of a much more complicated jigsaw. So although the IPGRCs are important, the rods and cones are also important. So the strange diagram in the middle is showing essentially an electrical circuit where we have light coming in, generating electricity, which then goes through the brain, and there's a contribution from each of the sensors, including the rods and cones that we have for vision. And what the conclusion of this workshop was that we need to take all into account, and the research that had been done had never done this. So when you looked at research prior to 2013, a lot of the data was very difficult to interpret in terms of input stimulus to an effect. And that resulted in the publication of these action spectra. So this is the key point. That technical report, 16791, if you manage to buy a copy, most of it is a whole load of numbers, and the numbers are those action spectra. So we have the three, the S cones, M cones, and L cones for vision during daylight, the rods for nighttime vision, low-level vision, and the IPRGCs. They're all normalized to 1 because the part of the jigsaw we don't have is how to join them together. So do you need, for example, during the day, a lot of exposure to IPGRCs or a low exposure, and through the night, what's the relative balance? And in terms of using this document is primarily aimed at researchers. It's not aimed at lighting designers. So what we need to do is to be able to look at this spectrum of the light that we have from our source, whatever it might be, and of course it may be many, many sources, and as that arrives at the cornea. We then need to adjust that for what actually gets to the retina. These cells, all of these 5 sensors are in the retina. They're in different parts of the retina, but the front part of our eye gets in the way and modifies the spectrum for what arrives actually at the retina. And this is, again, part of the challenge. And if you look at this data as a function of wavelength, we can see how the light is attenuated as we come down in wavelength. So as you get into this blue region, where the peak spectrum was for these intrinsically photosensitive retinal ganglion cells, is very critically dependent on age. Now the data was normalized to age 32, partly because it gives them almost equal distribution as you come down, whether you're younger or older. And the important point of this is, if you start introducing lighting which has a reasonably high blue light component, it will become more and more dazzling to younger and younger people. As you get older, less and less of that blue light gets through to the sensors that might be entraining your circadian rhythm. So it's actually a very difficult multi-attribute risk-benefit analysis to look at this and decide how on earth can you design a lit environment that is okay for everybody. If everyone is the same age, you can do it. But it says on average up there, even everyone at the same age won't have the same response. So we're very wary about really taking this to the next stage and saying this is what you should do. Because you'll almost certainly get it wrong for 98% of the people in the room. Assuming you've got 100 people and therefore 2 it would be right for. Unless, of course, they're all the same age. So in terms of using this document, it's, as I said, aimed at researchers, not lighting designers, lighting engineers. And in any particular environment, your light source will be from many different, your light exposure will be from many different sources. So what we need to do is to see what arrives at the cornea and measure that spectrum. We then correct that spectrum for age. So if we know how old the people are, we can take bits out, put bits in. We then apply each of these 5 responses, but then we add them up in some manner. And that's the bit we don't know. And that's where the research needs to be. And anyone who's trying to sell you human-centric lighting needs to have thought that through. And we correlate, if you're doing this as an experiment, we would correlate the exposure with the effect. And that's what has not really been done until the last few years. So what does this mean in practice? Is we now have a set of action spectra which will probably change. This CEN document is a technical report, it's not a standard. CIE is producing a standard, hopefully this year, which will modify some of those factors very, very slightly. We still don't know how to add them up, and that's going to take some years to work out. Now, hopefully people will do experiments in controlled environments and come to some conclusion. It's almost certainly not going to be the same for everybody, we know that. And for some people, this intervention, whatever it might be, will be good, but there might be an equal number of people where it's bad. Of course, daylight is a major influence on all this, and often a very small exposure to daylight counteracts whatever you've done in terms of artificial lighting, because the levels are so much higher. And people who ask for daylight lighting in their workplace or at home are probably asking for problems anyway. The time of exposure is very important, and also whether the effects are sustained over time. You can do an experiment and you can create an effect. If you carry on that exposure for a period of time, well, people just get used to it, your system get used to it. There's only one part of our visual system that doesn't get used to the exposure, and that's the pupil dilation and constriction. Most other things that we expose ourselves to, the body gets used to it. So we also have this problem about what we call it. CIE calls it integrative lighting, partly because it's wider than just humans, and partly because humans have been exposed to light for a long time, and this is something slightly different. I'm going to stop there and thank you.